In October of 2010, the Institute of Medicine released its landmark report, The Future of Nursing: Leading Change, Advancing Health. The report is a blueprint for optimizing the contribution of nursing to address a wide range of changes to the nation's healthcare system. And it's already impacting nursing education. At UC San Francisco, the School of Nursing gathered a panel of healthcare experts to discuss the recommendations outlined in the report. These are some of their comments.
So the Robert Wood Johnson Foundation, in an unusual partnership with the Institute of Medicine, developed this project, and the project has two very important parts. The first was the usual Institute of Medicine report with recommendations that are vetted by the very robust review process of the National Academy of Sciences. That's really important because as you go out to try to implement this, you need to understand that there is a strong evidence base for these recommendations. This is not maybe. And the recommendations include reconceptualizing the role of nurses within the context of the entire workforce, expanding nursing faculty, examining innovative solutions to healthcare delivery, new models of care, and attracting and retaining well-prepared nurses in multiple settings. And here are the four key messages. Nurses should practice to the full extent of their education and training. They should achieve higher levels of education and training through an improved education system. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And effective workforce planning and policy making require better data collection and an improved information infrastructure.
As a group of UC deans and program directors, we've been thinking about what it means to be at UC now. We have so many issues right now that are absolutely coming together in an alignment of the stars. We have the IOM report. We have healthcare reform that's underway and under discussion. We have changes in the demographics of California, more aging, greater diversity in our communities. We have a tremendous momentum to build on. So this is an opportunity we cannot miss. But in our education and thinking about what we want for the future, it's about equipping nurses to be ready for the practice of today, because clearly when they graduate, they need to go out and be competent. That's not enough. We also have to prepare them to think about what should the future be and equip them with the kinds of skills and knowledge and confidence to be able to go out and say, hey, this system's broken. These things are not working the way we want them to work. So that they can actually use their imagination to change that system. That's a really important difference besides just graduating people for today's world. And that's something where UC can absolutely lead. As UC faculty, leadership is our hallmark. Obviously, the people who are attracted to be part of UC are leaders in the field. And that's a capacity that we have that is, to a large degree, I think, untapped. It's time to take that leadership out of the ivory towers, and many of you are already out of the ivory towers, so don't take this as a criticism. But in general, I think that we don't get out enough to put our leadership into action in the community where we need to be. UC is home to many talented researchers, and we need data like crazy to be able to look at the future of nursing. And as oftentimes there's a simplistic view of what workforce is. We say, okay, this is the need right now. These are the people that are going to retire, and they're going to retire by this date, so let's just get that many people into the workforce. That's not the question. I mean, that's part of the question, but that's tiny. The real question is, what's happening with our population? Where's health going? What are the needs going to be in the future? If we redesign the system and make it a little bit different, what's the right mix? What are the right kinds of people to mobilize for what needs to get done?
Thank you, and it really is my pleasure to be here this morning. I want to just take a moment here and highlight the purpose of the California Action Coalition. First of all, is to engage the diverse stakeholders in the initiative for the future of nursing. We need to engage the business community, the purchasers and payers of healthcare, consumer groups, our labor partners, our policymakers. We need to engage the larger community in this if this effort is going to be successful. We also need to ensure that the work we're moving forward is aligned with other efforts underway to address healthcare reform in California. Another purpose is a very important one. We need to not only come up with statewide recommendations that we need to apply statewide, but also system changes that actually support those recommendations. And lastly, the important piece is to carry the message that this is not about nursing. It really is about the health of our communities. It is about nursing's contribution to the health of our communities, but it is not about nursing per se.
So first, I think it's important to understand the imperatives that face the provider community in the healthcare system today. And just taking California's example, there will be an estimated 4.4 million additional Californians who will have health insurance by 2014 if health reform proceeds as it is planned to be. We are woefully inadequately prepared to take care of an additional 4.4 million people in the near future. In addition, the current cost of care is unsustainable, let alone the perceived increases in cost of care at a rate higher than the consumer price index. So we absolutely have to address this, and I think many of the tenets of the IOM report are absolutely in line with that. Third is the fact that despite our improvements in quality in some areas, if one looks at quality systematically, it's highly variable across the state, across UCSF for that matter. And even if you average it out, and you took the average quality, it's still not even good enough. So that remains an underpinning of the imperatives that face us in the future. Okay, so those are great plans. We do have some barriers, and they've been alluded to before. Scope of practice is huge, and I think needs to be addressed. It's not the kind of thing that an individual institution can address, but all of the UCs together, along with Kaiser and Sutter and whoever else needs to be involved, I think potentially can be an important force to address the scope of practice limitations in California. But we also have financial limitations and compliance limitations, which are both at the state and federal level that have to be addressed to really, I think, optimize performance. So I think the challenge for us is to using the tenets of the IOM report in the context of the powerful market forces that exist and health reform, figure out which barriers we have control over and overcome them, and participate with others in overcoming the barriers that are beyond the reach of an individual organization. So with that, I'll stop. Thank you very much.